Hey, what's going on? I'm going to do my medication competency. First thing you want to do is you want to go ahead and get your order and get your sheet from the MAR or the MAR and just double check to make sure that the medications match what the patient is taking based on the provider's order. So you're going to get regular insulin, that's 1 ml over 100 units. It's on a sliding scale, so you follow the instructions for that. It's sub-Q. It's an 8 o'clock med, so we're doing 8 o'clock meds for Mrs. Ford. Digoxin 0.25 daily PO. So for the regular insulin, she is taking insulin on a sliding scale, and they seem to be matching up as far as the numbers. 468, 200, 249 for 4, 250, 299 for 6, 300, 349 for 8, and 3 over 350 you want to call. Furosemide 40 milligrams, that's going to be PO daily. That matches here with the MAR. Digoxin, that's 0.25 daily PO, that matches as well. You're going to go to potassium chloride, 8 MEQs daily PO, that matches as well. So let's go introduce ourselves. Knock knock. Hand hygiene. Hey Mrs. Ford, how are you this morning? I'm going to go ahead and administer some medications. But first I want to go over a couple things with you. First, can I get your first and last name? You want to get her armband. Hey, okay, Ford, Agnes, or Agnes Ford. Date of birth, Mrs. Ford, 5/12/40. Okay, wonderful. Mrs. Ford, do you have any allergies to medication? No, I don't have any medication allergies. Okay, wonderful. Do you have any allergies to anything? She says no. You move on. And so, Mrs. Ford, I want to go over an assessment with you. I want to make sure that everything is safe for you to take. So what we're going to look at is insulin. You're looking for blood sugar, which is 230, and it's 4 units for her. You're going to check to see if she's MPO. If she's MPO, especially for rapid or short acting. This is a regular insulin, so you don't, you have to just know your protocol when it comes to regular insulin. This is not a fast or rapid acting. You want to make sure she's not nauseous, and then you want to make sure that if she has food, that would be again for short or rapid acting. But again, know your protocols when it comes to regular, or intermediate or long lasting, either one. Next, we're going to furosemide. That one you will need to know the potassium K serum level. That one's going to be 4.2, which is in range. Next is digoxin, apical pulse 72, digoxin level. We didn't get that level on this paperwork, but if it's lower than 60 BPMs for an adult, you want to hold on the digoxin. Yeah. So, that's for apical pulse. The digoxin level, again, if it's high, you want to hold. You want to talk to the provider first before giving it. And lastly, we're looking for furosemide. That one's blood pressure. So the blood pressure is 146/84, which is pretty raised. So yeah, it would be an indication to give it. Serum K level again is 4.2, which is normal, which is in range. Next, Mrs. Ford, everything is clear. We're gonna go ahead and gather our medications and supplies. We'll be back. And so I'm gonna step out. I'm gonna go get my medications from the Pyxis. First one I see is insulin. It's a regular insulin. It's 100 units. You want to make sure that it matches with your paperwork. And make sure the expiration date that is not expired. So 2/28, so it's good. So you want to put that right on your paper. Next, we have digoxin 0.25, 10/20. This one's not expired. So that's the next one. And then we're going to get furosemide 40 milligrams, 11/20. So you want to, yep, that's clear. Looks good. Lastly, potassium chloride, 8 MEQs. That one's expiration is 11/20. And so is for furosemide, 11/20. So everything is good. Everything's not expired. You want to get your supplies. You want to get yourself let me scoot that over here. You want to get yourself a couple alcohol pads. You want to get your insulin syringe. And we're ready. Now we're going to go back to Mrs. Ford's room. Give her a knock, 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 knock. Hey, Mrs. Ford, I'm here to give your medications. I do need to check your first and last name and your date of birth one more time. You can get her armband. Make sure you double check again. All right, Mrs. Ford, let's go ahead. I'm going to go ahead and just check my medications first. So first one you're going to check is, again, insulin. That's 100 units per ml. Data expires 2/28. So that one's good and matches with your paper here. Regular insulin, 1 ml over 100 units. Sliding scale. Next, digoxin 0.25, 10/20. And that's daily PO. Again, potassium chloride, 8 MEQs, daily PO, 8 MEQs, potassium chloride, 11/20. The digoxin expires 10/20. This one's 11/20. And then the furosemide, 40 milligrams, 11/20 for expiration. And next, you have to do hand hygiene once you walk in, so make sure you do that before anything. And so now we can go ahead and grab your insulin, because that's priority at this point. You want to make sure you check it again. So insulin, this one's 100 units per ml. It's a regular insulin, and expiration is 2/28. So that's our third check for that one. Now we're going to go ahead and wipe the top of the insulin, clean it off. You want to go ahead and wait for that to dry. You want to open up your insulin syringe. Okay. You want to go ahead and, you should have drew the air when it was closed, but draw the air. 4 units. Now that it's dry, you can go ahead and nice and easy put it right in the middle. Put the air in, flip it upside down, make sure that it's in the liquid, then you're going to draw. Nice and easy. I'm going to go ahead and draw your 4 units. Okay. So what you want to do at this point is, that looks good. Alright. Nice and easy. Hold on, take it out. Recap. Nice and slow. You want to get a second nurse to come in to check your medications. And so once she checks the medications, 2/28 regular insulin, 100 units per ml, she's going to check the needle. It's 4 units. It looks good. All right, great. Say thank you. So now, Mrs. Ford, we have to administer this medication. I'm going to go ahead and insert it into your abdomen. She says, okay. We're going to go ahead and clean. You want to do it 2 inches away from the belly button and the abdomen, the lower quadrant on either side. And then you want to clean in to out from the site that you're going to give the medication. Once that dries up, you want to go ahead and tell Mrs. Ford, hey, Mrs. Ford, I'm going to go ahead and insert this injection. I'm going to grab onto your abdomen, and we're going to do this on the count of 3, okay? And then so you're going to go ahead and open this. You're going to grab on, you're going to say, hey, Mrs. Ford, here we go. 1, 2, 3. You want to hold on to your syringe. Insert 4 units. You want to wait for just a second. Okay. And take the needle out. You want to get rid of it in the sharps. If she's got some fluid or whatever, you want to make sure you can clean it up with 2x2. Put a band-aid on. Or if she's not leaking at all, just follow your protocol on that. And once we have discarded that, we are to focus on the third check for our other medications Digoxin 0.25 daily PO. That one's expires 10/20, so that one's good. Potassium chloride 8 MEQs, 11/20 it expires, and furosemide 40 milligrams PO daily, 11/20 expires. You want to grab your medication cup, so make sure you bring your supplies with you after. Oh, so that was no good. You're probably going to have to go get another one if that happens. But for now, we're going to go ahead and we're going to pop these medications in here. Oh, yeah, you can ask. We have to ask the patient, hey, how do you want to take your medication, Mrs. Ford? And she'll say, I could take them by mouth. Okay, and then so you can provide her maybe with something to drink. Hey, Mrs. Ford, or just check her orders to see what she can drink. Maybe get her some water if you're unsure. Make sure she's not NPO. Put your medications in the cup. Okay, great. You want to hand her the medications. Make sure she's not dysphagic. That's a word. You give her the medications. Give her a little bit of water on the side right there on her table. She takes the medications. You watch her. And after that, you want to go ahead and clean up. You want to go ahead and document. And I believe that's it. Document your initials, date and time. Wash your hands. Throw your stuff away. And that's it. Have a good day. Say thank you to Mrs. Ford if anything.